Let's go back to our earlier story about the cost of dental care in this country. A mouthful of pain that never goes away. That's how one beneficiary has described living with the ongoing suffering that comes with her dental problems, which are too expensive for her to fix. She's one of thousands of people on low incomes getting MSD help to cover their dental costs. Figures show work and income is paying out more than $20 million a year. But more than half of that money is essentially loans that have to be paid back. Joining me in the studio is Ricardo Menendez March from Auckland Action Against Poverty. Good evening, Ricardo.
Kia ora, Lisa.
If we can start with the Minister's comments on this. Carmel Sepuloni has said that dental grants are increasing year by year. This shows that people are getting what they are entitled to. Is she right?
No, I think what she's missing is the fact that we have an inadequate public health infrastructure that is not suited to address our growing oral health inequities. And so, these figures do not reflect a change in culture at work and income. If anything, they reflect the fact that more New Zealanders are struggling to afford paying for dental care, and that more kids are growing up with poor dental health, leading to the situations like the one we saw in the story tonight.
So, how significant is the debt burden for these people?
It's massive. I mean, just in 1 year, there were $15 million accumulated in debt because of these grants. And this number just keeps going up. There were 70,000 people that required a grant in a period of 1 year, which is massive. And, these are the people that actually manage to get to work and income, that are able to take time off. We know many people carry ill oral health and do not take time off work until it becomes an emergency. And so this talks about how our system is not equipped to deal with it.
And realistically, is it likely that that money will be paid back in its entirety?
Many people will be carrying this debt for the rest of their life, and it's a debt trap, right? Because the money they're paying back each week is money that they cannot spend now on eating healthy food, which then has an effect in their oral health later down the line. And so this debt system is not fit for purpose, and it's punishing families who simply do not have the means to get dental treatment.
To be clear, this situation with Jill, the case that we've shown tonight, that's not a matter of MSD turning her down for a grant. She doesn't even want to apply for one because she says she doesn't want more debt. But arguably, there is assistance available to her. She's just not taking it up, some people would say.
Well, I mean, the prospect of carrying such a massive financial burden for the rest of your life is a barrier for people to even want to access this help. We know from ministries' own figures that about 44% of people who don't access dental care, cost is one of the main reasons. And so we need to address cost barriers, which includes making those grants non-recoverable, so making not as a debt, but also looking at the socioeconomic determinants of health, such as access to healthy kai, and inadequate incomes, and other things.
So what are you suggesting? Should everybody get dental care for free?
Dental care should be a universal right. We know that other parties around the world are leading on this. So, Bernie Sanders and Jeremy Corbyn and a few other politicians are already putting proper policy proposals on this. We know it's possible. And New Zealand is lagging behind compared to other OECD countries when it comes to oral health inequity. So I think this is time the government steps up, puts a proper policy platform, and subsidizes oral health for adults as well.
So are you saying for everybody, just for beneficiaries, people who meet an income threshold, or who should get this subsidised or free dental care?
I think what we've seen overseas with other policy proposals around this is that universal approach is probably most effective, but that is just one part of the puzzle, right? We can't ignore that things like even being able to travel to a dental clinic, taking time off work, are other barriers that lead to people not accessing dental care. So access to dental care that is cost efficient is one part, but ensuring that kids have access to healthy food, ensuring that people can take time off work is the other part. The Prime Minister can take time off work to go to the dentist with no financial burden. Why shouldn't ordinary New Zealanders be able to do the same?
Well, it's going to cost us. And do you know how much it would cost us? Have you got any idea?
The cost that it would incur on the government would be alleviating the household debt that we know people have with the ministry. So, we currently are putting families $15 million on debt a year. This cost should be met by the government, and it would remove a lot of household stress. So independent of the costs, the main thing is actually not burdening our low-income families with crippling debt that is leading them to then require food grants at work and income.
So the thing is, the government did have a welfare expert advisory group that made a bunch of recommendations around low-income families, and one of them was, among those recommendations, was that they review these kinds of grants and maybe revise them upwards to cover the likes of dental care. I mean, where would you place that in terms of priority? Because there were, 43 odd recommendations from this report. Dental care and paying for dental care, where does it sit in those priorities for you?
It should be one of the most urgent things that we should be addressing. I mean, ill oral health has massive consequences on people's abilities to find employment, to their self-esteem and to their mental health. But at the end of it, the fact that the government hasn't acted on most of these recommendations speaks of the lack of political will to take action, not just on welfare, but on public health altogether.
Well, yesterday, I think it was Carmel Sepuloni outlined what we would call her roadmap for the future in terms of welfare. Aren't they stepping up?
Well, no, they're not. I mean, they're talking about a 2 to 5 year plan, and at no point the minister is talking about increasing core benefit levels, right? She keeps ruling it out, and the Welfare Expert Advisory Group was clear that this is something that needed to happen urgently. It should have happened yesterday. And so it's a bit cruel for the minister to be telling people on the benefit to just wait a few years for potentially a surprise on income levels rising. And at no point dental was mentioned as part of that roadmap when she spoke at the summit yesterday.
Appreciate you coming into the studio this evening. That's Ricardo Menendez March from Auckland Action Against Poverty, talking about, access to dental care.